Antibiotics are medications used to kill bacteria or to slow down the growth of the bacteria. Antibiotics help to prevent and treat bacterial infections in humans and animals. Many medical advances are dependent on antibiotics' ability to fight all types of bacterial infections, including chemotherapy and treatment for chronic diseases. Antibiotic resistance occurs when the bacteria develops the ability to defeat antibiotics that are designed to kill it, which means the bacteria is not killed and it continues to grow until the point where it becomes antibiotic resistant. This bacteria is often called a superbug, where it has high levels of resistance to many different antibiotics. Antibiotic resistance happens because of overprescription of antibiotics, overuse of antibiotics in livestock and fish farming, poor hygiene and sanitation, and lack of new antibiotics. The emergence and the spread of superbugs are made worse mainly because of the misuse of antibiotics in humans and animals. In industrial farms, they use antibiotics to compensate for overcrowded and poor living conditions of the livestock instead of using the antibiotics to treat sick livestock. Direct contact with animals, agricultural drainage, contaminated water and poultry products help facilitate the spread of superbugs from farm to people. Same way with countries that do not have standard treatment guidelines, in which antibiotics are often overused by the public or overprescribed by the health workers and veterinarians. Antibiotic resistance has the potential to affect people at any stage of life, making it one of the world's most urgent public health concerns, aside from threatening food security and development. Each year in the United States, at least 2.8 million people are infected with antibiotic-resistant bacteria, and more than 35,000 people die as a result. No one can completely avoid the risk of superbugs infections, but some people are at greater risk than others, especially infants, elders, cancer patients, and those with chronic illnesses. Patients who undergo treatment such as organ transplants, major operations, dialysis, and even women giving birth are all at a greater risk of getting infected. If antibiotics lose their effectiveness, then we lose the ability to treat the infections and to control the public health threats. Antibiotic resistance is rising to dangerously high levels in all parts of the world. New resistant mechanisms that are emerging and spreading globally are threatening our ability to treat common infectious diseases such as pneumonia, tuberculosis, blood poisoning, gonorrhea, and foodborne diseases. When infections caused by superbugs can no longer be treated by first-line antibiotics, more expensive medicines must be used as they are becoming harder and sometimes impossible to treat. This situation will lead to higher medical costs, prolonged hospital stays, increased mortality, and increased burden on families and societies. Antibiotic resistance is putting the achievements of modern medicine at risk. Organ transplantations, chemotherapies, and surgeries will be more dangerous without effective antibiotics to help prevent and treat infections. Even common diseases like urinary tract infection will be difficult to cure and can be life-threatening as the bacteria becomes increasingly resistant to antibiotics. Antibiotic-resistant diseases are predicted to overtake cancer as the top cause of death globally in the next 30 years, with experts predicting that one person will die every 2 seconds. According to the World Health Organization (WHO), the Center for Disease Control and Prevention in the United States and many other public health experts stated that we may soon live in a world where antibiotics are no longer effective against drug-resistant bacteria. Without immediate action, we are on the verge of entering a post-antibiotic age, in which common diseases and mild injuries can once again kill. As for that reason, WHO has been promoting a global campaign annually since 2015 to raise awareness of antimicrobial resistance. This campaign encourages best practices among the general public, health workers, and policymakers to avoid the further emergence and the spread of antibiotic-resistant infections. The World Antimicrobial Awareness Week takes place every year from 18 to 24 November with a slogan, "Antimicrobials handled with care," to represent the growing occurrence of drug-resistant diseases. First-line prevention practices that everyone should do are use antibiotics only when it is necessary with the right dose and duration. Take the prescribed antibiotics as instructed and finish the entire course of medication until there is none left. And also, never share or take others' antibiotics. Wash your hands, cover your mouth when coughing, or stay home when you are sick will also help to prevent the emergence and the spread of superbugs.